Hi, my name is Dr. Malsberg, and I'm a psychiatrist here at Radial. In this video, I'm going to give an overview of what TMS is. TMS is a non-invasive treatment that uses a magnetic coil gently placed on your scalp to send magnetic pulses into specific areas of your brain. Non-invasive means the procedure is performed entirely outside your body without any need for surgery, incisions, or anesthesia. The magnetic pulses create small electrical currents in neurons. In simple terms, parts of the brain that can regulate mood can become underactive or overactive in certain conditions. TMS uses focused magnetic pulses to activate or slow down those nerve cells. Repeating those pulses session after session is thought to retrain the network so it fires in a healthier pattern, kind of like how physical therapy retrains a weak muscle. TMS is generally very well tolerated. Because it's highly targeted to specific brain areas, it doesn't cause a lot of the systemic side effects that people experience with medications, things like weight gain or sexual dysfunction or sedation. The most common side effect is a mild headache or scalp discomfort at the site of magnetic pulses. These side effects are usually temporary and subside shortly after treatment. A rare but serious side effect is seizure, but the absolute risk is very low and comparable to many of our commonly used antidepressants. Because TMS uses a powerful magnet, you can have treatment if you have any non-removable metal in or near your head. Here I'm thinking about aneurysm clips, cochlear implants, or deep brain stimulators. We also need to know about any other implanted medical devices like pacemakers. Typically, dental fillings, spinal infusions, and braces are fine. It's also very important to let us know if you have a history of seizures, epilepsy, or any significant head injury, so we can take those into account when we're trying to weigh the benefits and the risks. We strongly recommend keeping all medications stable during your TMS treatment. Any changes should be discussed with your doctor first. We also recommend keeping things that can affect the seizure threshold stable, things like alcohol use, substance use, sleep patterns, and caffeine intake. Consistency helps make your treatment as safe and effective as possible. A typical TMS course depends on the protocol that's chosen for you, but the easiest way to think about it is in terms of sessions. First, let's look at what a session looks like.
Alrighty, Greg. So in 3, 2, 1. What do you think?
It's good.
Alright. I'm right here.
Sweet.
First session, I'm going to turn it off. I'm going to remove the helmet and then I'm going to remove the cap.
Okay.
Right?
So, a session is usually either 3 or 10 minutes, depending on what's prescribed. In standard TMS, you do one session per day for about 6 weeks. An accelerated protocol just means that you're doing more than one session in a day. Usually, we do this with a 50-minute break in between sessions. Insurance typically covers a set numbers of sessions per day, which are then distributed across multiple days. Here at Radial, we often see patients do 2 per day, 5 per day, or 10 per day. I'll walk you through what it looks like if someone has 5 per day, so you have a better visual of what it looks like. So, on your first day, you come into Radial and you get situated in your room. Then we take some time to map the motor threshold. You don't need to know what this means. Then we usually do a treatment that lasts somewhere between 3 to 10 minutes. This is then followed by a 50-minute break where you'll be hanging out in a room. During the breaks, you can relax, be on your laptop, read, get work done, whatever you want to do in the room. This pattern is then repeated 5 times. And since it lasts an hour, a typical day with a 5 per day session is a 5-hour day. There's no special preparation needed. You can eat normally, take your medications as you normally would, and you won't be put to sleep during TMS. You can drive yourself to and from the clinic, and many patients return to work or school immediately afterwards. We usually recommend wearing comfortable clothes. Definitely avoid any metal jewelry, especially on your head or neck. If you do forget, just make sure to remove it before treatment. It's also helpful to bring things to help you relax in between sessions. Things like a laptop, a book, headphones to listen to music or podcasts. You're welcome to bring a friend or family member if it's helpful for support, but it's not required. You'll be awake and alert sitting in a comfortable chair. During treatment, you'll hear a clicking sound from the machine and feel a tapping sensation on your head. A common metaphor for what it feels like is like a woodpecker tapping on a baseball helmet. It can definitely feel strange or uncomfortable at first, but the vast majority of patients get used to it really quickly. If it ever feels too strong, just let the technician know and we can adjust the settings. Some people notice mild headaches or scalp tenderness, but these usually fade pretty quickly and usually are helped with over the counter pain relievers. Yes, so there's no sedation, so you can drive yourself home, you can return to work, exercise, or run errands immediately after treatment. If you get a headache or feel tired, a short rest or over the counter pain relievers usually help. Response timing varies. Some people notice improvements over just a few days. On average, responders start to feel better midway through the treatment, usually around treatment number 20. Others don't notice improvement until the end. At Radial, we often use protocols that fall between standard and highly accelerated approaches, so we commonly see changes usually within the first 1 to 2 weeks. How long benefits last varies from person to person. In large follow up studies, most people who respond maintain improvement for at least 3 to 6 months without any additional treatment. About half still feel better at 1 year. If symptoms do return, they often come back more slowly and less intensely than before, and patients usually respond well to a shorter booster course. If someone has a good response to TMS, then usually retreatment works really well. So, we often describe it like filling a gas tank, like a mood gas tank. A full course fills the tank all the way. For many people, that fuel lasts months or longer. But over time, stress or biology can lower the level. Booster or maintenance sessions can be used like quick top offs that help keep things running smoothly. Not everyone needs them, and if they're needed, they're usually shorter than the original course. So you wouldn't get the full treatment, but say maybe 5 or 10 treatments. One of the biggest advantages of TMS is that it has fewer and milder side effects than medications. You don't see weight gain, sexual dysfunction, or sedation. Still, it's important to know that there are risks and to know what those are so you can make an informed decision. The most common side effects are scalp discomfort and muscle twitching. During treatment, you'll feel tapping on your scalp, like we said, described as a woodpecker tapping on a helmet. This can feel uncomfortable or painful at first, but usually it improves over time. Headaches can occur, especially early on in treatment. These are usually mild and respond well to Tylenol or ibuprofen. Fatigue is another common side effect. Often people will feel mentally tired afterwards, similar to like studying for a really long exam. This usually fades as your body adjusts and resolve once treatment is over. Some patients do get ringing in the ears, especially if they already have tinnitus. Earplugs are always provided and we highly recommend wearing them. Occasionally, people feel briefly lightheaded after treatment. Very rarely, people will experience temporary coordination issues like fumbling with buttons. These effects are short lived and usually resolve after treatment ends. Mood changes can also occur, such as feeling more irritable, anxious, or tearful early on in treatment. These changes are usually temporary and just reflect brain adjustment. But if you do experience them, do let your doctor know as soon as possible. The most serious risk is a seizure risk. So TMS lowers the seizure threshold, but it's comparable to or lower than many antidepressants. If a seizure occurs, it's typically brief and stops once we turn the machine off. We know TMS does not cause epilepsy. Always use earplugs. Communicate if the stimulation feels too strong. Use over the counter medications for headaches. Make sure to keep hydration, sleep, caffeine, medication, and substance use as consistent as possible. Let your provider know about any new or worsening symptoms so adjustments can be made quickly. For most patients, TMS side effects are mild, temporary, and manageable. While rare complications exist, safety checks and gradual adjustments are used to make the treatment as comfortable and effective as possible.